Hello everyone, this is Dr. Aman from Edupedia Overseas. We have the possibility today to meet a very important lady here in this university. Could you please introduce yourself?
My name is Leila Fadiani. I am professor of immunology and same time I'm a program leader of the BAU International University Batumi medical program, and I'm a dean.
Wow. So it's our pleasure to finally meet you and to find out more about this university because you have many international students. Can you tell us a little bit more about your university so the students in India and the parents can get some more clue what they can expect here?
So, university have, as you mentioned, there are many international students. It's unusual for Georgia because majority of Georgian universities have students from 2 or 3 countries. Mm-hmm. Here is more than students from more than 10 countries, and it's a very good circumstances for the doctors, especially because of globalization shows us that doctors can work everywhere, in every country. The borders are open. Mm-hmm. So to study and to understand how to communicate with people from different culture, from different religious, and such community, it's like the training of our students, and not only studying the medicine but studying how to communicate with such a different people, and it's necessary for the doctors especially.
I totally agree. So where are the students coming from mostly? Which countries?
It's Egypt, Turkey, post-Soviet countries, Kazakhstan, Kyrgyzstan, Azerbaijan, from Arabian countries, from different countries.
All right. Mm-hmm. So this is a private university, as I understand. And what makes you as a university special? Because most of the viewers may also know that there are many universities in your pretty country, but what makes this university special and unique?
Oh yeah, there are a lot of. We are caring about each students. We are like a family. Mm-hmm. We know all of them. We are helping them in social problems always. Mm-hmm. We have all information about their scores, their problems, their gaps, where we should help them. Mm-hmm. We have very good mentorship and tutorship institute. There are each classes have their mentors for the clinical practice and tutors for the educational and social purposes. Mm-hmm. So always they are informed about the students. They are helping them, supervising them. So it's one of the best way, especially for the freshmen, because they are coming from different countries. They are like the kids from the beginning. Sometimes they are coming and complaining. So some classmate doesn't look at me very well.
Really?
So really, it's
like in school.
Yeah, like in school. Even sometimes like in kindergarten. So, and we are caring about all of them.
But that's really good. If the student has the feeling that they can share everything with you, that makes
everything. And one is there are not so huge amount of the students. I have possibility to meet all of them. Yeah. I am reachable always. They can come, ask me something, talk with me. So it's unusual for big universities. Next one, of course, we have been starting the implementing of the integrated program from 2015. Again, it's unusual for Georgia because we was the first university in Georgia who has the integrated program from the beginning. Later on, just now, all universities, it is a mandatory to have an integrated program. But from the beginning, it was optional, and we started from integrated curricula. It allows us, from the beginning till now, to improve it. to polish it very well.
Okay, for the viewers who don't know what it means, can you explain?
Yes, it's not classical curricula as a subject when students studying subject by subject separately, something, for example, histology separately, anatomy separately, physiology separately. In our curricula, it's a system-based, and student from the beginning start to study histology, cytology, embryology, physiology together of, for example, circulatory system. Or the same subject of the gastrointestinal system. So it allows students to make a link between the subjects and collect information together, same time. From the beginning, they start to studying the normal function and physiology of the organs, same time with small amount of the pathology. And then later on, it's like let's say we're building year by year the normal physiology and pathology decreases, and pathological and clinical part increases. So it's a mixing. Clinical part of the education and normal part of education, and it allows it's more interesting for students, because when you are explaining something on the mechanisms, they don't like it to study. But when you are saying that for the heart disease, when this mechanism is broken, what happens, they are more interested on it.
So you make sure from the beginning that it's not only theory and different subjects, like you put it together to make it more practical, so the students, they can actually understand what's going on in the body. Wow, I heard it for the first time, this kind of system, but I can imagine that it was like kind of very difficult to create this kind of curriculum.
Yeah. It was difficult. Just now we are very fluent in it, because we had approximately 7 years to adopt on it. And very interesting thing is that from the first year of education, they have ability to go to the hospitals.
That's a very important point.
Because of of course, for freshmen the hours is less than for second year, third year, and so on. But anyway, they understand what does it mean the hospitals, or what does it mean inpatient and outpatients, and how the hospitals work. Later on, of course, on the higher classes, they spend more time there. From third year of education, they are starting the rotation. What does it mean? It means that they are going. They spend time in each subject. For example, in pediatry, in neonatology, in general surgery departments, and they are spending the time. But again, we on the sort of year of education, we are mixing very well the clinics with theory, and there is one of the big block which title is Introduction of the Basic Science into the Clinical Subjects, and it means that they have only cases, clinical cases, because at the first and second year of education they already have a knowledge about about pathology. On the third year of education they can solve the clinical cases, only clinical cases. And it's very interesting for students, because when I'm always asking, and this is another good point of our university, we always asking students how what is the best way to give them the knowledge, and what is the best way to understand where they have gaps, and how they should fill these gaps. This is a very important thing for the implementation of program and for the reaching the learning outcomes after the finishing of the program.
So it's very common for you that you actually reflect your own program and also adapt whatever the students, maybe they suggest something. And about the practical part, because this is very very important for the Indian parents and students to know. The students, do they go in groups to have the practical part in the hospital, or are they stationed in different departments?
This is one of the best part of our curricula. Why? Because of I think that when you are sending 10, 12 students in a group in the hospital, it's impossible to explain to 12 students something, or to allow 12 students go to the patient's room. None of the patients want to see 12 students in
I agree.
Majority of them are against. That's why we have very small groups. It's very effective, believe me. When in groups there are 2, 5, or in case 7 students maximum. We don't have any group which contains more than 7 students. So that's why all teachers are concentrating on the small groups. They can explain everything. And once more, we have special logbooks when we are sending students to the hospital. Supervisor, mentor always with students. And this is a logbook where there should be filled information what students did in hospital. Especially the manipulation, how many injection, how many, for example, central venous catheters, how many measuring the blood pressure or something else, different.
So they are allowed to actually do it under supervision.
Under supervision, in frame of our medical benchmarks. Because we have Georgian medical benchmarks, which is based on the WFMIS medical standards, and in frame of these standards, all manipulations which allowed to do under the supervision, they have to do.
Okay.